Thank you so much for having me. I'm Dr. Shravan Subramanyam, MD of Wipro GE Healthcare. Now, India is all set to be the most populous country in the world, and while we are seeing an increase in our population and the aging of our population, one of the issues that we also deal with are the diseases that are attributable to aging. Several NCDs are out there. Cardiovascular is probably the one that deserves a lot of attention because it can be managed, it can be treated early, and there's also ample opportunity to screen manage this well before a patient reaches a stage where they require critical care. Last I read, close to 5 million deaths are attributed either directly or indirectly to cardiovascular diseases. And what I want to convey here is by the time a patient reaches a stage where they might die of cardiovascular diseases, there are a lot of signs that we can look for to identify and manage a patient, whether it's hypertension, whether it's diabetes, congestive cardiac failure. These are all signs that eventually, if they are not managed well, they could lead to serious morbidity and eventually possibly death also. In terms of how we manage a patient, there could be a myriad of reasons. It could be lifestyle related, it could be genetic related, nutrition, and how early disease is managed really manifests into how late disease is handled. The last couple of years, as we've grappled with COVID, has really shown the role and importance of MedTech in managing healthcare. Couple of observations. Pre-COVID, by and large, healthcare tended to be concentrated in some of the larger cities where there was plenty of infrastructure, maybe a lot of the corporate hospitals. But due to the strictures on travel imposed by COVID, we found that technology allowed healthcare to be delivered closer to the home. Right? So point of care management of patients, at-home management of patients, and also more distributed healthcare. We found that access to healthcare has come closer to people in some of the smaller towns, tier 2, tier 3 cities and districts, simply because now the technology is available, there's a lot of awareness, and there has been some investment that's going into medical technology. So GE has been present in India as Wipro GE for the last 30 years, and we have been working across care areas. We've developed a lot of solutions for cancer care, for neurology, and now considering the clinical requirement of cardiac care, we're emphasizing and putting in a lot of effort on managing the patient's journey for cardiac care. As I mentioned earlier, cardiac episodes are not, in one single point of time. If you consider a patient's journey, right from screening an apparently healthy individual, all the way to diagnosing an actual disease, managing that therapeutically, monitoring that after the intervention, all the way until a patient is completely cured or being managed on a continuous basis. This is the journey of a patient, or I should say individual, even before they become a patient. And we are taking the conversation to health care, right? We want to develop healthy people, not just curing or treating patients, but keeping them healthy well before they require a serious intervention. So with that in mind, GE not only has a host of its own solutions, we're also developing IT products, and we're partnering with the overall ecosystem. For example, when you talk about some of the diagnostic and therapeutic elements, there are other device companies. Boston Scientific is a terrific company that has some solutions in the diagnostic and interventional space. So many pharmaceutical companies and hospitals, they're doing some amazing work in this space. So we realized that we have to work together collaboratively as an ecosystem to be able to solve for the cardiovascular disease burden in the country. Today, with precision medicine, we're using sources of data from across the board. It could be genetic information, it could be family history, it could be lifestyle history. Then you have histopathology information, you have molecular imaging information, you have all these inputs coming to you. And then the clinician is able to synthesize all of this information using a lot of the digital tools that are available out there. Now we have some AI tools also that are giving predictive models that can help a clinician judge what might be the best therapy. So within India, in terms of our plans, we have a very strong technology center which is developing products in India and for the world. And we also have a strong manufacturing base where we are producing in India and for the world. Now, considering the NCD focus and specifically looking at, say, oncology and cardiovascular, in the near term, and working together with the PLI scheme of the government, we have launched a new factory a couple of months ago. And our first product, CT scan, came out a couple of months ago. The next product that will be coming out of that factory will be in interventional guided surgery. And so for a cardiac catheterization lab, for example, they require this equipment, and this will be manufactured in India for India. There is a very significant need for this. You know, there's a surge in need for interventional labs, cardiac cath labs across India. Not just the product, but also in terms of manpower and skills. So we are investing in that space. And eventually, we'll also be bringing in our cardiac CT, you know, a high-end cardiac CT 128 slice, to ensure that we have products in India for India to deal with the disease burden, particularly of cardiovascular, across the country.